My name is Melissa Justice. I'm a registered nurse and a certified diabetes educator, as well as a community health worker. I also am a chronic care manager, so I often get calls in regards to patients' concerns or needs, or things that they need a little more education on or an explanation on. I am their extended vision and their hearing, and I'm the boots on the ground.
Okay, wait hard. It's getting warm today, ain't it? Is that feeling good? Well, I'm hot.
I'm as grateful for my patients as they are for me. They give me more than I could ever give back to them. I am the person, I guess, that you would say that helps them connect the dots, kind of a resource person, clinic-wise and in the community as well.
Can you take some deep breaths? Yeah.
I would give anything to have had a community health worker for my mother. I wish there would have been a me when she was here. You know, she passed away with complications of diabetes and congestive heart failure, and I really feel if she had a me as a person in the background, she would not have died so early at the age of 60 from complications of that. I guess maybe that's why the compassion that I have for her is here too. Sometimes personal experiences set you in the right seat to be the driver or the navigator, I guess, for others. That you make a promise to yourself that you will not let others fall through the same cracks. When you go in the home, it's a different world. It really is. What you see in a home and then what you see here at the office or even them on the street, it's just different. You realize why they didn't come to their doctor's appointments. You realize why they didn't get their insulin this month. You know, you can only gather so much in a 15-minute office visit. But whenever I go to a home, I can see so much more and read between the lines that patients may not know they need to disclose, but it's important for me to know in order to meet them where they are and to render to them the education they deserve and need to manage on their own. Some of these patients have no one to reach out to, so they tell us a little more and let us into their lives a little more than the other patients do or what have you. So we build that rapport with them and they trust us and we trust them, and it's a win-win for them and it's also a win-win for us, because with this job comes great reward that is not met by a dollar. You know, there's no way that you can put a price tag on somebody's quality of life or how they view their life. I have just recently brought a patient down from 11.4% A1C to down to 6.8, and that's a big deal. When you're talking about decreasing their A1C, you're talking millions of dollars saved, and the increase in quality of life for that patient's unreal. By 1% reduction, you're decreasing that patient's possibilities of amputation and starting on dialysis by like 48%.
He usually stands up.
You can let him sit down.
I need to check your blood pressure though, so why don't you sit down while I do that? Just like for 5 minutes.
You can take my spot. Here, come over here.
Small. So what we starting at?
Wherever you want to.
Oh, it's like that now.
Be good.
Craig and I go a little back. We were first co-workers together a long way back, and then he became very ill. He had 2 strokes. He was very hypertensive always. He will admit not controlling his hypertension. I had an amputation of his toe, so I've come a long ways with Craig. We've rode many times together. I don't know, we just go back and forth. You know, he calls, he's in need. and I make sure that need is met, and then the trust just begins. And then with that trust, you know, trust is earned, and as well as respect. So I think that's the thing. He trusts me, he respects me, and I trust and respect him.
We can be able to
Go ahead and
sell
answer him.
Yeah. Oh, because I'm giving you a plug, that's what. Nah, she is. She looks out for me.
I am extremely proud of that fella. He's really come a long way from someone that just didn't attend his doctor's appointments for various reasons to attending all of them now. He never misses an appointment. He always has his labs drawn. I just wish that he could have done it years ago to prevent dialysis and then this transplant and all that.
I know I joke around and everything, but without them, I'll probably be dead. I'm serious.
Tell him what your A1C. So he went from 11.6
To 6
to 6.8 in 3 months.
That's amazing.
Just by 1% droppage, he has dropped his amputation rate by 50%, the blindness by 48%, cardiac, and the strokes, additional cardiac issues and strokes by 48%. So that's a huge impact. If you had a drug that could just drop someone's A1C by 2%, you would have $1 billion industry. But I have to say, he is the one that did all the work.
I'm gonna let you stand up here
that
just
is
a second.
exactly why.
Actually-
You are a walking miracle.
Let's see what it says. All right, hold it still. Quit moving.
I'm what moving?
I think everyone should become a community health worker. I feel that you should not let the opportunity of a community health worker to escape your fingertips. Like I said, it sets us in our place. It takes us all back. It's humbling. It's rewarding. Everybody needs to start as a community health worker.